Hi, my name is Marcel Hebert, and for my condition report, I have multiple endocrine neoplasia. Today, I will be discussing the overview, symptoms, history, treatment methods, and possible prevention methods of multiple endocrine neoplasia. Multiple endocrine neoplasia, MEN for short, also formerly known as Warmer syndrome, is a rare autosomal genetic disease which affects about 1 in every 30,000 people. There are three different types of multiple endocrine neoplasia that are used by medical professionals to diagnose a patient as well as treatment options for the patient. The three types are MEN1, MEN2, and MEN4. MEN1 is classified by a mutation to the MEN1 gene. This gene expresses DNA which instructs the body to create proteins called menin. Menin is the body's natural tumor suppressor, which is used to control proper organ growth and prevent the rapid division of cells. If the gene is mutated, the tumor suppressing protein is often not present and cells will divide and multiply out of control, sometimes causing life-threatening carcinogenic tumors. Type 1 multiple endocrine neoplasia is often characterized as hyperparathyroidism, which is an overactivity of the parathyroid gland. A symptom of a tumor growing on the parathyroid gland is heightening levels of calcium within the blood, which often leads to kidney stones, thinning bones, nausea and vomiting, and hypertension. Variants of the MEN1 gene are associated with benign and malignant tumors in the parathyroid glands, pituitary glands, pancreas, duodenum, and stomach. Type 2 MEN is classified by a mutation found within the RET gene. Type 2 actually has three subtypes used for diagnostic purposes based on the combination of tumor growing patterns and symptoms. The first subtype is called MEN2A and is classified by medullary thyroid carcinomas, pheochromocytoma, and parathyroid disease in patients. MEN2B, the second type, is the most aggressive subtype present amongst all MEN diagnoses. The condition, much like MEN2, presents with a medullary thyroid carcinoma and a pheochromocytoma, yet a distinctive feature features a thickened lips, marfanoid habititis, and skeletal abnormalities. The only difference between MEN2A and MEN2B is the lack of parathyroid issues and the physical abnormalities present with a diagnosis of MEN2B. The final subtype of MEN2 is called familial medullary thyroid carcinoma. Medical professionals are only able to properly diagnose a person with FMTC if they observe tumors arising from C cells found in the thyroid gland. Type 2 multiple endocrine neoplasia is the least common diagnosis. Symptoms appear similar to symptoms found in type 1, yet it is caused by mutations of the CDKN1B gene. This gene provides the instructions for making a protein called P27, where it plays a critical role in controlling cell division and growth. Moving on to the history of the disease, here we have four of the men responsible for the founding of multiple endocrine neoplasia: Dr. Erdenheim, Dr. Weimer, Dr. Sippel, and Dr. Steiner. In 1903, Dr. Erdenheimer discovered the first causes of tumor growths on multiple organs. At the time, he discovered a patient presenting with pituitary edema and three large parathyroid glands. His documentation of the case is medically recognized as the first known report of what is now known as multiple endocrine neoplasia. In 1954, Dr. Weimer discovered a disease which caused tumors to grow on endocrine glands. He also discovered that the condition was passed to offspring as a dominant transmittable trait. He found that the disease equally affected both sexes, and either parent can pass on the gene. He eventually went on to name his discovery Warner syndrome. Another doctor in 1961, named Dr. Sippel, described the coincidence of thyroid cancer, parathyroid edema, and pheochromocytoma in a single patient. He believed the coincidence of thyroid and parathyroid involvement was bilateral and multigranular. He also discovered the disease was familial. He named his discovery Sickle syndrome. All right, now we come to 1968 when Dr. Alton Steiner, upon various years of research from his predecessors in the study of endocrinology, concluded that Warmer syndrome and Sickle syndrome were separate entities yet similar in nature. He introduced what is now known as multiple endocrine neoplasia and devised that different types based on tumor growth patterns amongst the endocrine organs. Dr. Alton Steiner actually recently passed away in May of this year, yet his legacy lives on in the discovery of multiple endocrine neoplasia. So now let's talk about diagnosing and treating multiple endocrine neoplasia. So it is actually currently an incurable disease due to the mutation of genes. Yet, while this condition is incurable, signs and symptoms are easily manageable if detected early. Early detection methods include receiving regular clinical evaluation of glands located around your neck for swelling, knowledge of familial history with MEN, genetic testing to see if you may be a carrier for the mutation, and regular monitoring of hormone levels. Now, I'm going to speak briefly about a study done in the recent past and describe treatments used to combat tumor growths. Between 1998 and 2003, 13 patients presented with MEN-related tumor growths. Medical professionals used endoscopic ultrasonography and laparoscopic techniques to contain and remove tumors on these affected glands. Welcome to the present and future of treatment options. In 2019, 150 scientists and clinicians gathered at MD Anderson Cancer Center in Texas for the 16th Multiple Endocrine Neoplasia Workshop to discuss the future of treatment options. The workshop primarily focused on issues in the connection and treatment of cancerous MEN tumor growths, medullary thyroid carcinoma, pancreatic neuroendocrine tumors, malignant pheochromocytoma, and parathyroid carcinomas were the main aspects of MEN-related cancers discussed during this workshop. The researchers and scientists aim to gain a better understanding of how the identified molecular defects in these genetic syndromes lead to transformation, how to apply targeted kinase inhibitors and immunotherapy to treat these tumors, and important clinical management issues. Susceptibility of multiple endocrine neoplasia is not contagious, so we shouldn't have to worry about the condition. Yet, if you have a family member with the condition, it is recommended by medical professionals to get checked regularly to stay healthy. Now, a person who is born with the disease has one mutated copy of the MEN1 gene per cell. Type 1 is autosomal dominant, meaning one parent has the potential to transmit the gene mutation to offspring. As shown in the picture on the side, it shows that the father carries the condition while the mother does not. According to the picture, an affected individual has a 50% chance of passing this gene on to their offspring. More than 90% of individuals who do inherit the MEN1 mutation will develop one or more symptoms of MEN1, meaning tumor growth or hyperparathyroidism. So, there's no surefire prevention method to completely avoid multiple endocrine neoplasia, but medical professionals suggest the partial or entire removal of the thyroid gland to prevent cancerous growths. If the gland isn't present, there are no tumors that can grow. If the gland is removed, doctors will prescribe medicine to keep hormone levels regulated. This concludes my presentation on multiple endocrine neoplasia. I hope you all enjoyed listening and learning a little something new today. Thanks for watching.